Okay, so let's talk about Wernicke-Korsakoff syndrome, which is a complication of thiamine, which is vitamin B1 deficiency, and it usually occurs due to alcohol use disorder, starts as a Wernicke encephalopathy, and if it's not treated, it progresses to Korsakoff syndrome. Now, it not must be as a result of alcohol disorder. It can also be secondary to other things that we will see, that includes, for example, bariatric surgery, hyperemesis gravidarum, everything that can cause, or prolonged fasting, everything that can cause low levels of vitamin B1 may cause Wernicke encephalopathy, and if it's not treated with vitamin B1, it will progress to Korsakoff syndrome. Now, Wernicke encephalopathy can present with the triad of confusion, ataxia, and ophthalmoplegia, but it doesn't have to include all of them, and it even can present with none of them. So be aware. Now, the usual areas of involvement on T2 flare hyperintensity signals is the dorsomedial thalamy, tectal plate, periaqueductal area around the third ventricle, and the mammary bodies. And we will see those. Now, as you can see, the clinical presentation we talked about, and if it's not treated, so it will become Korsakoff syndrome, which present with memory loss and confabulation. Now, pathology is based on deficiency of vitamin B1, and you can see the list of things that can cause it. Alcohol use disorder is the most common, but other things that can cause vitamin B1 deficiency can cause it. Now, on MRI, you can see T2 flare hyperintense signals in those areas that are presented here. T1 contrast enhancement can be in the mammary body. It can be with diffusion restriction, and that's it. Now let's look at some images. So you can see here the medial thalamus that is hyperintense right over here. You can see another one, and DWI that is hyperintense, looks like DWI. Another flare imaging with around again thalamy, I think maybe more close to peventricular regions, and yes, here again the medial thalamy due to gastric surgery. Here you can see periaqueductal gray. You can see around the periaqueductal gray matter hyperintensity. This is T1 hyperintense on the mammary body, and this is it. This is about Wernicke-Korsakoff syndrome.